Okay, so George, now what we're going to do is look at the microscope, and I'm going to bring it in. Tina has volunteered to be our pretend patient for this, so I can set things up. I just want you to show some adjustments. And I'm going to sit as I bring this thing in. And one of the things that we, I guess, neglected when we were talking earlier, and we just have to factor in right now, is the fact that when we were setting up the chair angle relative to my knee, we had forgotten to factor in the height of the foot pedals. So we've smartened up and done that for this step.
That's
and
correct,
so
yes.
it looks better, but now I'm going to bring in the microscope, and we want to go over the things that we have to control or adjust over here. So I've brought this in. So I'm just getting it into final focus. So I'm going to focus on Tina's iris right there, and this would be my potential working position.
So you want to make sure essentially what all the controls that they can offer you in terms of the coarse adjustments or the fine adjustments. And so if you look at this positioning over here on the center of the boom, there is a line marker to indicate when it is essentially neutral or in an upright position. And so that's just indicated of there. I can't necessarily see it so much, but perhaps Lauren, if you would be able to just verify if that's more upright.
Yeah, you got that pretty close to upright.
Okay, good. So the other thing you want to look at is this angle here for the oculars. You certainly don't want to have them angled all the way down, because that'll cause a lot of the forward, the sort of this protraction at the cervical spine, which you don't want to have. So even perhaps angling it a little bit higher up, that might give a bit more neutrality for the cervical spine. And of course, trying to draw yourself as close as you can to the unit. This way your neck is not having to do the full excursion, but rather your body is ensuring that it's doing that kind of work for you instead. And when it comes to the resident, you can also make sure that you're making whatever necessary adjustments are possible here for performing the assisting tasks over here.
So they should be thinking about the same thing of just setting up this angle over here on the assistant scope.
Absolutely.
So that their neck feels just relaxed and comfortable? Or?
Relaxed, comfortable, and ideally you'd want to have your ears over top of your shoulders or your AC, and that may not always be possible. But as opposed to doing this, getting into the habit of bringing myself even closer, because sometimes we'll see people doing this or just stooping back. But having in this position, or if you're sitting for that matter, always trying to ensure that you're leaning forward so that range of motion is taken up by the whole body and not just by the neck doing that kind of a task like that.
Okay, sounds good.